Hi everybody, I'm Torie Robinson and we have an unplanned Epilepsy Sparks Insights Ukraine special. With the war, there are indirect casualties. People in Ukraine cannot access their epilepsy medications, and those who used to have controlled epilepsy are now having seizures, status epilepticus, and some are dying. We bring you news on what is happening right now. Hello gentlemen, thank you so much for joining us today. Peter, could you please tell everybody just a little bit about yourself?
I'm Piotr Zwoliński. I am epileptologist and clinical neurophysiologist. I work in Neurosphera Epilepsy Center in Warsaw. We are Warsaw-based center for epileptology, let's say, the major center for epileptology in Poland.
Wonderful, thank you. And Łukasz, how about you?
Hi, I'm Łukasz. I'm the CEO of the Neurosphera Epilepsy Center here in Poland, based in Warsaw, and I'm cooperating with Peter, helping with epilepsy for our patients here in Poland, and now also for our friends from Ukraine.
Lovely, thank you. Well, let's go through these set questions, which I know you've split between you both. So first of all, can you just how did you get into this? How did you decide to start helping people from Ukraine? How did it come about?
It just came out the 24th of February when we found out after waking up that this terrible thing happened. This terrible thing started. Well, we were immediately dropping everything that we do because we usually take care of epileptic patients here in Poland, and also my foundation is caring about some cybernetic solutions in medicine. So we just kind of quit everything that we used to do normally, and we started to let's say, think what we could do in this situation. We, of course, knew some colleagues like Volodymyr Kharitonov in Kyiv, Jana Martynenko in Lviv, and of course Andriy Dubienko, the acting president of Ukrainian League Against Epilepsy in Kharkiv. So we started to write to them, to call them if we could help immediately. And what turned out within the next few days, that the majority of their needs is sending them drugs, because they had drugs only for 1 week. The supply chain of drugs, the pharmacies went down, everything practically went down. Now we are even experiencing some lack of food and things like that. So this is how it started. So we had to be for them. We had to start immediate help, which was obvious for me, because that's what decent people do. When you see your neighbors being attacked, slaughtered, I don't know how to say it, because there was a slaughter and some terrible bloody assault of this Russian. I don't want to call them federation. I would use a different word. So they are killed, they are bombed, they are deprived from life. So we started immediately to do whatever we could do. At the very beginning, it was very chaotic. So we started to organize this with Łukasz. And what we actually do now, we supply them with drugs. This is one thing. The other thing what I want to show is our Ukrainian Epi helpline.
Oh, wonderful.
2 numbers and 2 lovely girls, Tatiana and Irina. They are Ukrainians, they have 2 phone numbers, and they are trying to organize this Ukrainian help. Because, well, we think we should do what we do the best. So we just help people with epilepsy, because we are not involved in general help, because Poland started to provide a general help for Ukraine and Ukrainian people. But we, let's say, more focused on the epilepsy. So that's how it started.
That's just so lovely. And so can you tell us how exactly are you getting the drugs over to Ukraine?
Well, I would say the first wave was to collect drugs from Polish patients. It was like few hundred kilos probably of drugs, different epileptic drugs, and some different, even not only anti-epileptic anti-seizure medications, but as well as some neuroleptics, some anti-pain medications, and syringes, bandages, or whatever. So we were able to collect first, let's say, 2 or 3 convoys to Lviv, to Ukraine. And then we started to get help from all over the world. As we spoke before, Poland turned out to be the biggest hub for Ukrainian help, because we are the only entry, let's say, to Ukraine from the free world, let's say, because there are not so many active or friendly countries around. So Poland all of a sudden turned out to be biggest hub for help. So that's why everybody quickly found us as a center for anti-epileptic delivery, and that's how it started as well.
We already have sent 5 transportations with over 30 boxes, quite huge boxes of medicines, particularly the anti-seizure drugs. And each time we are looking for a safe and as fastest way to transport it. And that's why we had that connections with our friends from the other side in Lviv. So the first thing we do is to collect here all the drugs in Poland, in Warsaw. Then we transported them to Lviv. And after that, they are trying to spread them all around the Ukraine to help the individuals and the specific hospitals.
Once you get to the border, like to the other side, how are the medications reaching these different places effectively and safely?
They are going in a huge transports to Lviv, to the special, I would say, place of gathering, and then the Dr. Jana and Olga are helping us to do the list of the needs from all around Ukraine, and sending smaller convoys or people to spread them all around the Ukraine.
Once you depart from Lviv, you have to be a military convoy, because it's not safe anymore. You have to use military convoy to get to Kharkiv, to Kyiv, to Dnipro, and all those towns.
How many different drugs are you managing to get over? So anti-seizure medications, are we just talking, say, I don't know, sodium valproate, or have you got multiple different drugs?
Well, we just have received a list of, let's say, 20 to 25 different compound substances from Dr. Kharitonov from Kyiv, sorry. And well, we are in strict contact with the International League Against Epilepsy. We had a very nice and long talk with Helen Cross and officials from international leagues and also from IBE. So we send them the list, and we expect some external help, because in Poland we are a little bit short of drugs. You might expect that around 2,100,000 people from Ukraine is here in Poland. So we have to secure them with drugs. So we expect drugs from all over the world, and as a matter of fact, we get them from all over. But we have the full list for adults and for children. As I said, probably 20-25 different compounds, starting from phenytoin and valproate and very old drugs, even to Zonegran, lacosamide, and all kinds of drugs that are necessary, even parampanel and so. So they just evaluated how many packages they are using in Ukraine and sent out the list, and now we are in the process of getting them. So anybody is welcome. If somebody has any material help for us, it can be sent to us. You can find our address and collecting place here in Warsaw. Of course, it was at the very beginning, it was a little bit tough, because we didn't have the special permission for wholesale trade and so on and so on. So we had different problems, but Łukasz was able to deal with it, and somehow combined effort expressed by him mostly and our crew, we were able to get this all together. So we are expecting some donations from pharmaceutical companies. We are talking with Polish Sanofi, probably Global UCB, and so on and so on. So we are expecting them. But I want to emphasize, the time is the biggest value. They are dying there, they are suffering there, there are children without any medication. So as fast as we can be, the better is. So please be quick.
And I can actually, you can say from a personal perspective here, as a person with epilepsy, one time in my life, I decided I'm not taking my pills. And that was a big mistake, as you can imagine, and I was lucky I didn't go into status epilepticus. So for me, I can relate, and please, everybody listening or viewing this, know that this can happen to anybody affected by epilepsy. But of course, those even, for instance, with the rare epilepsies and especially refractory epilepsies, they're going to be even more likely to go into status epilepticus, I think, and get into a dangerous situation. So we can all relate in some way to this issue, and I back up completely. So pharma, please come and help us with this. And Łukasz, I think you were going to say something as well.
Yeah, I want to assure all of you that all the meds we already sent eventually go to the patients, to the individuals, but the path is rather like that we are transporting them to Lviv, then our colleagues, the physicians, spreading them around Ukraine, sending them to the Kyiv, Kharkov, Zhytomyr, I don't know the English word of the name of that city, and other cities. And as far as we know, those doctors there answering thousands, maybe not thousands, but many phone calls every day, each day, with people asking them with about the meds. So they are giving them for free. And as far as I know, it works very well that each neurologist that we cooperate with are really close with the patient, with the other hospitals in Kyiv, Lviv, Kharkov, and other cities.
Yeah, you must imagine that there are no departments, no clinics, nothing exists. People are hidden in cellars, in bunkers, and all very strange places. And for instance, Dr. Kharitonov is sometimes visiting his cabinet, but he's mostly in the cellar, having all these drugs in boxes. So people from Kyiv come to visit him to acquire some vigabatrin, valproic, and so on and so on. And this is how it works. They're only acting, as they said, 3 different wards in the whole Ukraine, which are temporarily open, but majority is hidden in the cellars. So this drug collection is from hand to hand, let's say.
This shocking. Yeah, 2022, and this is going on.
Yeah, this is regular, bloody, very irrational war.
And not solely killing people directly, but also inadvertently, right? If you don't have access to the drugs that you need, whether that be anti-seizure medications, whether it be insulin or whatever, then people are going to die that way. Would you say there have already been some deaths as a result of this? For people with epilepsy, that is.
We don't have exact data because our Ukrainian colleagues tend to be very, smiling, and well, I think they keep the, how to say that, good mood just for showing us that they can go on, but they are in a tragic situation. So we are trying to get anything that we could do. Even we pack some chocolate and some, I don't know, some sleeping bags, anything that we can gather here on the stores, because they are really in a tragic situation, not only as a epileptologist, neurologist, but as a humans, because they have nothing. The food is running out, so this is a terrible, terrible situation. So and we have to be quick, because we meet a lot of people who say, oh, we have to meet and discuss and make some discussion, brainstorming, what could we do for Ukraine? Let's meet within 2 weeks. It's not a time for such discussions. We have to act immediately, because they are dying there, really dying there. So we don't have exact data if somebody died there out of status epilepticus or something, but I would expect so. If you don't have drugs, if you develop status epilepticus, you don't have any qualified help in there. So what would you expect?
I was going to ask you both what is inspiring you to do this work, but I think you both answered that question.
Well, yesterday we had a big gathering when there was a Ukraine ambassador to Poland, Mr. Deszczyca, and he said, we thought we have big brother in Poland, but now we see we have very caring and loving sister, because Polska, our name is quite female, I would say. So we have to be a very loving, caring sister for Ukraine. We have to give those people anything that we could do. We have to even give our own things. We have to skip anything that we do, because those people are killed, are murdered, are slaughtered by Russians. So we have to do anything that we can, just drop anything that we do and carry help. So we decided the best we could do is provide anti-epileptic help, anti-epileptic medication. We have organized in Neurosphera epilepsy clinic here in Warsaw care system for epileptic patients from Ukraine. As Łukasz told, we have organized 40 visits this month. We are planning to have additional 100 visits and EEG and anything that is possible and necessary for them within April. So we have 2 Ukrainian physicians, Natalia and Marina, on the board with us since few days, and we are planning to have some more. So we will open, I would say, Ukrainian branch of Neurosphera. So this is what we can do. So we are asking, we are even begging for help, any financial help that could be provided to us, because money is not necessary in Ukraine, because you cannot utilize any money in there. But we can buy drugs, we can buy help, and we expect up to 50,000 patients from Ukraine here in Poland. So this is the volume that we have to, because we expect 5 million people from Ukraine. So 1% would be 50,000 patients. So these are patients that should be taken care of, and we are prepared to do this.
And of course that number, or that percentage, could even go up, since injury causing the epilepsies often. So I think, yeah, it might be even more than that. So you're both, we said, like, how can people help by donating? So I guess we're talking primarily pharmaceutical companies who can help out, rather than, well, what about people like me? What about, average people, if there is such a thing? How can they help?
You just brought a lot of help within this short speech, just to show everybody that the problem exists, that there are sick people very, very needing for immediate help, because it's not a broken leg or flu. It's a very severe disease sometimes, which needs which the help is necessary, and stable help is necessary. So we should scream all over the world that the problem is ongoing. We should expect additional, I don't know, months or years of such help, because the Ukraine will be totally destroyed as it is now. We expect that the help for Ukraine will be necessary for upcoming months or even years. So we should organize this.
Yeah, and for those who feel that they can't necessarily relate, look, we're all of the same species. We're all out of Africa, and we're no doubt, even though I don't know, for instance, any of my family from Poland, but no doubt there are, genetic similarities. So everyone is related in some way, and please remember that, and say that to your MP, your local politician. Let's get the message out there, because these people's lives are worth living, and they're worth just as much as us here on the call and anybody watching or listening.
I would underline that there are 2 dimensions of assistance that we provide. So the first one is the medical assistance for refugees here in Poland, and the second one is the med supplies for people staying there in Ukraine. So anybody could help us to provide both of them. Could try to contact us, Emergent Foundation of Piotr or Neurosphera, based on Warsaw.
What I will do then, I'll provide links to you guys, your profiles, your company pages and stuff like that. below this recording. So anybody interested, go check on those links and you'll be able to connect with both these gentlemen. And there's no such thing as a bad question. If you're not sure, you can always approach me as well. And let's just everybody keep thinking about this, because this problem is, like Peter was saying, is not going to go away. And these people need our help. So thank you so much, gentlemen. It's been an absolute pleasure having you here. You've been brilliant.
Thanks, Torie. It was our pleasure to speak with you.
To help save the lives of the people in Ukraine, please put pressure on your politicians and pharma companies. Tell them that Ukraine, just a few hours travel from us, needs anti-seizure medications yesterday, and that they must provide them. See links to people in the recording in the text below and on the website torierobinson.com/epilepsy-sparks insights. Thank you.